All right, well, good morning, everyone, and welcome to the ABIN monthly webinar. We are so glad you're here. I know it's a rainy, overcast morning where I am in Arkansas, so hopefully y'all have settled into the office, have your coffee, and are ready for a fantastic webinar. I want to remind you that this webinar is being recorded, and if you do stay on today's webinar, you're giving us your permission to record you and post this to the ABHIN website. So with that, we have the Veterans Administration with us this morning. We have a wonderful group that we have heard present, and we've heard about the different services they provide across Arkansas. And so we wanted to bring them today to ABIN to share these resources. We have with us Katie Rames, Miranda Watkins, Priscilla Buffington, and Laura Hopkins. And they're going to talk to us this morning about different services available in the suicide prevention program, as well as some of the community outreach services and resources that they have. As we were getting prepared for this morning's call, we were talking about all of us in some capacity come in contact with veterans, whether we're working with veterans, whether we have family members that are members, or just neighbors or friends. And one of the things that we all talked about is sometimes if you're not working within that system, it's difficult to know what are the resources that are available. And they have some really cool resources that are happening, not just within the VA community, but in these rural communities. So we wanted to give them some time this morning to share with us their programs and what they're doing for veterans. With that, I'm going to turn it over to Katie.
Okay, thank you, Kim. So good morning, everybody. We have a packed agenda today, and we just went through, let me see, here we go. So I'm going to start off and just give some overview of suicide prevention in veteran population and some facts and resources. And then our community engagement partnership coordinators, Miranda Watkins and Priscilla Buffington, are going to talk a little bit about their role, as well as the Veterans Health Administration public health approach to suicide prevention. And Laura Hopkins will be talking afterwards about Camp Connect, best way to identify service members, veterans, and families, and connecting them to resources. So before we begin, we will be talking about suicide today, and this is an intense topic for some people. So if at any point, if you do need to take a break or step away, an immediate resource that we do have available if you're needing to reach out to someone is the National Suicide Prevention Lifeline. And if you are a service member or veteran, you'd press 1 to get connected to that line. But we always just kind of like to mention that at the top of these presentations and just to check in if you need to. So I'm going to go over some facts about veteran suicide. Now we know that suicide is a national health issue. And so with rising rates of suicide in the general population, and in addition, suicide rates are higher and are rising faster among veterans than non-veteran adults. And kind of what Kim was saying, we work within communities, right? So we, even if we're not working directly with the veteran, we may be working with family members, loved ones. And this topic touches a lot of people. And so, for every death by suicide, approximately 135 individuals are affected. So when we're looking at suicide, prevention and postvention and support, this is really a community issue. And suicide is often, it's the result of a complex interaction of risk and protective factors at the individual, community, and societal levels. Risk factors are characteristics that are associated with an increased likelihood of suicidal behaviors. Some risk factors for suicide could include a prior suicide attempt, recent loss, legal or financial challenges, And then we also have protective factors, and these can help offset the risk factors, right? So maybe we do have some of these things going on for us on that left column, but we have a sense of spirituality, we have a mission, purpose, we have employment. These are all things that are protective. So our goal is to minimize risk factors and boost protective factors. This is some data from the 2022 National Veteran Suicide Prevention Annual Report. I just pulled a few graphs from here. It's available online, and I'd encourage you, if you want to do a deeper dive on this subject, this is a very educational and kind of helps with the most recent data from 2020 is the latest year that we have data on, but that is available online. We can see here from 2019 to 2020, the age and sex adjusted suicide rate among veterans fell by 4.8%. By comparison, the adjusted rate for non-veteran US adults fell by 3.6%. Decreased veteran suicide in 2020 continued a trend that began in 2019. And when we look at suicide rates by age, we see that from 2019 to 2020, suicide rates among veterans between the ages of 18 and 34 increased, while rates for each other age group decreased. And so that is an age group or something that is presenting as, having still increased risk. When we look at methods involved in percentage of veteran suicide deaths, we see here from 2019 to 2020, among veteran suicide deaths, the involvement of firearms increased, while poisoning and suffocation involvement decreased. And then in 2020, firearms were involved in 72.1% of suicide by male veterans, which was an increase from the previous year, and 48.2% of suicides by female veterans, which was a decrease of 0.2% from 2019. And this leads us to talk about lethal means. So in the context of suicide prevention, safe storage of lethal means is any action that builds in time and space between a suicidal impulse and the ability to harm oneself. Effective lethal means safety education and counseling is collaborative and veteran-centered. It respects the important role that firearms and medications may play in veterans' lives, and it's consistent with their values and priorities. So again, we're talking about, building in time and space between the impulse to act and the means to harm oneself, and this saves lives. The time between when a person decides to die by suicide and they act on that decision is often very short. So this was from a study in 2005 that it found that 71% of attempters estimating the process took less than an hour. This reality really underscores the importance of reducing access to means for those who are at elevated risk for suicide until the risk period passes. And when having these conversations, also recognizing access to lethal means increases suicide risk for everyone living in the home. So these conversations can happen in that context as well, when we're looking about practicing safety. An acute phase of a suicidal crisis is often brief. So the purpose in having these conversations kind of ahead of time, or when somebody's really, not in active crisis and able to discuss this topic, right, is that I might not get to talk to you within those 5 minutes, 20 minutes, or within that hour. But if we can, if we can have a safety plan, if we can have this discussion and put things in place, we can reduce risk of suicide. And this picture here on the right, illustrating that means matter. So how a person attempts suicide affects how fatal the injury will be. So about 90% of firearm-related suicide attempts are fatal, as compared to approximately 5% of suicide attempts by all other mechanisms combined. And we know that people rarely substitute one means for another. So it's important to restrict whichever means they have in mind to use. And lethal means safety, it works. This is one of the few population level interventions that's been shown to decrease suicide rates. About 90% of people who survive a suicide attempt do not go on to die by suicide. So if we can collaborate with veterans ahead of time to help them survive a suicidal crisis, we've likely prevented suicide for the rest of their lives. And when I send the slides, I'll have the links here. There are, through VA, there are resources available for like how to have this conversation with veterans, and kind of tips for providers. This is something that suicide prevention also can meet with, in community with folks to kind of do training around that. And the picture here I have is our lethal means safety brochure, which is available online, or suicide prevention coordinators usually have those in stock to send out in community as well. So the VA's 3 core tenets for suicide prevention continue just to remain kind of the effort of our, the foundation of our efforts. So suicide is preventable. Suicide prevention requires a public health approach combining clinical and community-based approaches, and that everyone has a role to play in suicide prevention. So as a suicide prevention coordinator with VA, we wear many hats in my department, and one of them is doing community outreach, tabling, and also doing training, and just kind of building bridges to from community resources to VA, or even just providing this information, because we know that a lot of veterans don't receive their care at VA for a myriad of reasons. The main training that we do, I kind of call our bread and butter training, is our VA Save. And this is a gatekeeper training. It's meant to, provide somebody the tools to get a veteran in crisis to help, no matter who that person is, community member, provider, everybody, I think, benefits from this training. And it goes over our SAVE acronym, so recognizing signs of suicidal thinking, knowing how to ask the question, right? Are you thinking about suicide? Are you thinking about killing yourself? Providing, validation for the veteran's experience, and encouraging treatment and expediting getting help. So we are available to do these in person or virtually, and our training usually lasts about an hour or so. And we also do, we have some resources around safety planning. Now, safety plans can be completed whenever clinically indicated and should be a collaborative process. So we do provide training around that. And there is a public-facing kind of document here from the Veterans Crisis Line that has the template of the safety plan, closely mirrors what we use at VA. I'm going to go over some resources. So when we're talking about VA, and we were kind of talking before, it feels kind of this impenetrable thing, right? I think when we're working in community, I know I absolutely felt that way. And my first job here, I was at a primary clinic for seniors, and the VA was all of 5 minutes away from my office, and I had no idea who to call or how to connect anybody. So very basic stuff. First off, VA has 3 arms, one being the Veterans Benefits Administration. So those are veterans service officers, or kind of anything to do with benefits received, service compensation. If somebody is wanting to appeal an other than honorable discharge, which can be a barrier to getting certain care, they would go through VBA, they would talk to a veterans service officer. That is a different branch than we have the Veterans Health Administration, which is where we represent the VHA today on the call. So that's our hospital system, obviously mental health system, and there's also the National Cemetery Administration when we're talking about VA. So if somebody's talking to me and complaining or stressed out or concerned about service connection or this or that, I can't help with that, but I can make sure that they get to the right place to talk to someone. So And there's this idea too that I heard someone say that I have taken on, which is knowing the next right number. So if you are talking with someone and they're like, I did serve for, 3 years, I had an honorable, I had this or that, but I don't know if I don't know if I qualify. I don't know if I'm over income. I've never really tried, connecting with VA. The VHA eligibility line is on the screen here, and that is something that they can call. And I don't know how long you may or may not be on hold. I've heard some folks tell me it just took 20 minutes and, they were able to get through and confirm that they were eligible for services. But it is something that, you can sit with the patient and maybe call together. And then I had the VHSO, Veterans Health Care System of the Ozarks registration line on here too. But what's really important to know, there's no wrong point of entry. So a veteran can walk into an outpatient clinic through VA. They can walk into the closest emergency department, like at a VA medical center. They can call in and say, hey, I need to see if I'm eligible, or I need to start that process. So you don't need to know all the ins and outs of eligibility. I certainly don't, but I need to know where to get them to the next right number, right? There's also a website I've linked on here that has other avenues that you could go through. If somebody wants to fill out a form, they can fill out a form. And also a website for finding a VHA clinic or VBA location. I've also put on here, and I think our CEPCs will have a full list, but the VHSO mental health locations in Arkansas as well, which are numbers that I definitely would have benefited from having when I was in community. So I wanted to share that all with you as well. Our Veterans Crisis Line is, can't overstate enough how important this resource is. This is available to veterans, family members, service members, friends, anybody who is a veteran, service member, or is a support person or cares about someone who's a service member or veteran. It connects folks with trained crisis responders, and it's 24/7. There are 6 national call centers, and you can call center, talk to somebody, and if they offer like, hey, do you want someone from your local VA to call you back? Or if they request that, or if they're like, I need to get connected with mental health, or, I've had folks call for a whole spectrum of reasons. Crisis is whatever that means to you. Then they will send a consult to the suicide prevention coordinators at their local VA. So someone from me or someone from my team will call that veteran back. And we absolutely have folks calling through the crisis line too. I need to get connected. I need to figure out what my next steps are. And that's available through chat or an online chat as well. It was started in 2007. There's been over 1 million referrals to suicide prevention coordinators. They can also send out an emergency service dispatch if somebody's needing to go to the hospital. They can do, if deemed appropriate, on the call, they will send out a welfare check, a wellness check. When we get those consults, we call over 3 business days, 1 call minimum for each business day, and then we'll send a letter afterwards if we can't get a hold of the veteran, just saying, hey, we're here if you need us, we're trying to reach you, and this is how to get a hold of us. You can also go online, the Veterans Crisis Line resource locator to find an SPC or a local crisis center, medical center, outpatient clinics, etc. Suicide prevention coordinators, like we have, I know at our VHSO, we have a number, it rings to voicemail. We check the voicemail once a day. We are not crisis responders, but if somebody does want to call us directly and like, hey, I need some resources around something, they can do that and they can leave a message. Here's a website called Make the Connection. This is an online resource featuring hundreds of veterans telling their stories about overcoming mental health challenges. I really love this resource, especially for someone who might feel isolated or feel like that they're alone in their experience. And it also does have, I think, videos of caregivers as well. It's not clicking for me. So there we go. And here's the keepitsecure.net if you're wanting to learn more about the importance of firearm and other lethal means safety. Nearly half of all veterans own a firearm, and most veteran firearm owners are dedicated to firearm safety. It's important to know, so when having these conversations, kind of always starting from that point of view, of course, and this also just gives us some more information, maybe some more talking points, and for your own education as well. The VA also has, I don't know why, I'm sorry, I don't know if it's the weather or what. There we go. VA also has mental health mobile apps. So these are some self-help apps. They're treatment companion apps. The VA is a leader in evidence-based psychotherapy. So if they, maybe a veteran is going through CBT-I for insomnia, they have a treatment like companion app that they can do with that. They also have other support apps like tobacco cessation as well. And if somebody does download the PTSD Coach app, the safety plan in there mirrors the paper plan currently being used. So that could be mobile. Coaching into Care is also a really great resource that when I am tabling, I've had people come up to me and kind of asking about this resource, or it's pretty clear that this is something that would be helpful for them. This is a national telephone service of the VA, and it aims to educate, support, and empower family members and friends who are seeking care or services for a veteran. So how to have a conversation that feels fruitful versus, I think, folks kind of coming together and maybe can feel like we're not getting anywhere in our conversation. So I think they coach a little bit on some motivational interviewing stuff and how to have supportive conversations with the veteran in their life. And the Suicide Risk Management Consultation Program is available for any provider in the community who serves veterans at risk for suicide. So they provide risk assessment kind of information, lethal means safety counseling, what's best practices for documentation, and they also provide support for a provider who maybe there's been a loss of a veteran to suicide. And we call that postvention, and it's available again to community providers or within a workplace. And this link here, they have films available on that site, as well as podcasts or kind of infographics as well. And PsychArmor Institute, VA's partnered with PsychArmor to also have like a short version of a VA safe training. It's about 25 minutes long, and PsychArmor also has trainings on military culture, working with caregivers of veterans. It's a very big library of resources, and so that is free, and I would encourage anybody who's interested to check that out. And so that is the end of my piece, and I'm going to switch over. Let's see, let me mute myself.
I have a quick question, Katie.
Yeah.
And I thought this was so important. One of the things when you were talking about lethal means safety, you had a slide showing that typically, and I think it was a very high percentage of suicides were thought about and attempted within the first hour. In your experience, are you seeing that in the patients that you're serving? And could you speak maybe a little more to that?
Yeah, so anecdotally, so one of the, one of the things that we do as well in my program is kind of working with our veterans who are deemed to be at a high risk for suicide. And in conversation, I mean, I can say, I think that Yes, I mean it's brief. We see this a pretty quick kind of relationship between having this thought of suicide and to action. I've had folks describe it as almost having blinders on, like I couldn't see anything else, and this was the only thing that really made sense in the moment. Um, and that when they are able to, and the other thing I like on there too, that one of the slides is, there's 90% of folks will not go on to die by suicide if we can get them into care. I think address some of these. There are no quick fixes to the problems leading up to that moment, but if we can get them into care, we can provide more coping skills and like resources for folks. But that is something that I do see kind of borne out in my conversation with folks, and I feel like, again, just kind of underscoring, and that's why we talk about it when somebody's having a more stable day, right, or they're doing okay, because it can happen, it can escalate pretty quickly. Yeah, it could. Yeah, so yeah, that is something that I would agree with. Yeah.
And then the other point I heard you say is you do offer training, suicide training to community.
Yeah, so we offer training around like the VA Save I was talking about, and so some of those slides are pulled from VA Save, so like the lethal means data and information around that, and that's just a really great training, because I feel like I've done it for folks who've been social workers for a while or whatnot, and I like it because, especially when we're talking about how to ask somebody that question, are you thinking about suicide? It's really helpful to kind of unpack, I think, some of our own anxieties about asking that question, and having an opportunity to kind of unpack like why we need to ask that way, and why we need to be direct. And it helps folks have, I think, conversations that are going to improve safety for, I think, the person that they're sitting with, and also give them the why. I always say, like, this is like a why slide, like this is why we have these hard conversations, or this is so we do that. And then there are trainings for like lethal means safety counseling, how to have those conversations as well, and around safety planning.
Awesome, thank you. I just wanted to highlight that. So if anyone on the call is interested, please reach out and know that this type of training is available for you and your community.
Yeah, we would love to, again, understanding that a lot of our veterans don't get care through VA for different reasons, or they might come to VA once a year for their hearing checkup, and they're seeing you in community for primary care or other services, right? So we want to make sure that we're reaching everyone where they're at. And so I will, Miranda and Priscilla, are you all, I'm going to mute myself, and then I'll advance. Okay.
Great, thank you. So I'm Miranda Watkins, and I'm joined by Priscilla, who's my partner counterpart. We are community engagement and partnership coordinators with the VA. So like Kate was just mentioning, it's really important that we recognize, and you'll see it several times throughout our presentation. We know that not everybody comes to the VA, so that's kind of our purpose, is to try to set up safety nets and community to support veterans where they live and where they choose to get their care. So we really appreciate you being here with us today, and being committed to ending veteran suicide. Okay, next slide. Next slide. Oh, okay. Okay, so we're going to talk about mainly the public health strategy for the VA. And I just think it's important to start with an anchor of hope. And you heard Kate mention it. I'm going to say it again, that we come to work every day with knowing that suicide is preventable. And that's our mission, what we do. So at the VA, of course, we're dedicated to ending veteran suicide. but we know that we cannot do it by ourselves, partially because of the reasons that we just mentioned. There's 20,000 or 20 million US veterans out there, and it's going to require a comprehensive public health approach to suicide prevention to reach all of those veterans, anyone who might need us. So the VA is moving toward a blended model of combining community-based prevention with the evidence-based care that we can provide within our VA walls. In the past, I've been at the VA about 12 years, and I'm a social worker. I've been in several different roles, but when I started about 12 years ago, I did veterans justice outreach. And so I was out in the jails and the courts, and a big push was to try to get as many people as possible to come to the VA. And that just doesn't work for everybody. Not everyone is eligible, and not everyone wants to get their care with us. So when the opportunity to work in community engagement and to work with the VA, and the realization that that we're going to have to do some things differently, that was really exciting to me. So myself and Priscilla are going to talk about what we do, but I also love, so next slide, sorry, there's a video, and it kind of does a great introduction to some of the things that we're going to talk about. Hopefully it works. Don't hear the beautiful music that goes along with it. Oh, I think it's starting over. Okay. So in 2018, the VA published their 10-year plan that aligns with a lot of state and national plans that all come together to make up a strategic goal and direction for preventing suicide. And it is community based for all the reasons that we've been talking about. And that is what gives Priscilla and I and other CEPCs, community engagement and partnership coordinators, our framework for how we're going to do our work every day. I think Kate mentioned it, and I'm sure if you've worked with anyone who's ever been in crisis, then you are well aware that suicide is not just a mental health problem. It involves multiple factors, and it's very complex. So we have to have both the community base for supporting people and the clinical skills and intervention in the community and at the VA for preventing suicide. So we're focused on, for clinically based intervention, we're focused on the short term, but for the bigger picture and combining the two, it's a full public health model, and it's a long-term commitment and approach. So, Priscilla and I, the work we're doing now, we may not see benefits from it for, who knows? We're very early prevention. About 65% of the veterans that die by suicide each year have not accessed care at the VA in the year prior to their death. And it really does just drive home the importance and the need for us to all work together. Next slide. So Kate is a suicide prevention coordinator at the VA. I think there's, I don't know, probably over 450 suicide prevention coordinators around the nation, and what they do is so important and needed. They do outreach, like she mentioned. They're also focused on following up with people who are in crisis, have been in crisis at the VA, making sure that they have a heightened level of not care, but can't think of the word, that we're watching them more closely. So they have a lot of kind of focused stuff that they're doing within the walls of the VA in addition to their community work. And what Priscilla and I do as CEPCs is expand and enhance what they're doing. So we are part of the suicide prevention teams, but we're based solely in the community. So we're not going to be following up with folks who have been in crisis. We're out there trying to meet folks like you who might be in primary care clinics, or just individuals who are interested in suicide prevention. I mean, we'll talk with anybody who has an interest in doing this kind of work, or partnering to facilitate building coalitions at the local level, at the state level, at the individual level. We have some folks that have, I mean, we just meet anywhere. My hairdresser happened to strike up a conversation with her, knowing that she's lost several folks to suicide in her life, and knowing that the hair salon I go to has had some recent loss as well. And they are just regular, folks out in the community, but they want to do something. So we're going to help them organize and figure out the direction that they want to go, and and see what that work looks like. But we know that they have loved ones, they have neighbors, they have people who come and sit in their chair who are in crisis or have been in crisis or on the other side of that. And so, you know, they can be valuable. Anybody can be valuable in preventing suicide. So I think Priscilla is going to talk more about our role.
Yes, good morning. I'm Priscilla Buffington. I am the counterpart to Miranda. We are attached at the hip and get to do this awesome work together. I'm also a social worker at the VA, and I'm coming up on 10 years. And so I'm just going to expand a little bit more about what our day-to-day looks like, because I know even for us, we were coming into these roles, it was so exciting, but then when we went to start doing it, it was like, this feels too abstract. And think for a lot of people in thinking about traditional suicide prevention, it's totally different. And I know for Miranda and I, who have spent the last, you know, however many years prior to this doing very clinical work, this public health approach was just new and odd. It's not a new idea, but for the VA, it's new. And it's just kind of thinking outside the traditional confines of what we think about prevention traditionally. So a little bit more about it is we work to, again, expand what our current VA suicide prevention team members are doing. We are a part of the team. We work with our VA suicide prevention team members very closely, just complementing their work. We are 100% non-clinical, again, which is new for us. We are used to kind of being boots on the ground, you know, being there, doing all the, you know, doing the safety plans, helping with the crisis management, but we're doing it now in a very different way within the community, not necessarily face-to-face in a hospital or in a clinic with veterans anymore. So we do provide education on suicide prevention. We help with trainings. But more than anything, the vast amount of our work is coalition building. So a lot of what we do, kind of in a nutshell, is community organizing. We help, like Miranda said, her hairstylist, the mother who was affected by suicide, the friends who lost somebody, who express interest in doing something, trying to figure out how to prevent this from happening again. We keep our ear out and we try to find those people and meet with them wherever they are through a vast majority of Arkansas, and figure out, okay, what does that look like for your community? What does that look like for the region or the area that you're working in? Who can we invite to the table? How can we make this happen? How can we make this feasible? And what do you think is the most important part in doing that within the area that you're living? Because for some people that can be decreasing isolation because they live in a really rural part of the state. For some people, it could be more lethal means education. For some people, it could be, we need to make sure we're identifying who's out there because we have no idea, in hopes that would eventually down the road lead to a decrease in suicides. So we're not, again, crisis interventionists. We are down previous to that, hoping that we just keep those rates of crisis from ever happening. Okay, next slide, please. Okay, so a little bit more about day-to-day. We kind of talked about this, is Miranda and I spend a lot of time traveling throughout the state, working to identify people, communities, groups, businesses, nonprofits, churches, whoever might be interested in doing something related to prevention, identifying them, and then serving a bit as facilitators, subject matter experts to create a bit of a group, a coalition, and just some bigger conversations in that community so we can eventually make some change happen. Again, like, it's not something we see immediately. It's a very long-term plan. And what's kind of cool is that these positions are totally new to the state of Arkansas. Miranda and I started in December, and because the positions have just been brought to RVA. So we have like a long outlook. So it's kind of exciting to see what us doing this work and complementing our suicide prevention team is going to do. But it's incredible. So I kind of say all this to say that this is appropriate for everybody. It's not specific to veterans. It's not specific to people within the healthcare, where we can talk and meet with anybody who is interested in prevention. So this suits a wide variety of people. For example, we're going to have this kind of exciting big community meeting coming up next Friday. We're just inviting a large swath of people with lived experience, people who own businesses, people who own gun shops, just whoever, so we can provide some basic suicide prevention education, and we can talk about coalition building if that's something that people want to start within the community, explaining how to do that. Next slide is just a breakdown of very simplistically what we do and how we work within communities. I can provide this out to anybody who is interested in it, but it just really breaks down kind of very specifically, you know, we help with action planning, trainings, outreach, sustainability, helping you assess your community for kind of all within the confines of suicide prevention. So I will go ahead and end there. And if anyone has any questions, oh, one more slide, I forgot. So this is not just specific to Arkansas. Our roles are starting to span the entire country, which is really exciting. But right now we have coverage, at least for us, for what's kind of valuable to you. These are all of our Arkansas facilities, our clinics. So if you're in a certain area and you're interested and you're like, I really want to get something started in our community, you can reach out to us. There's going to be 2 positions for us in Fayetteville. There's some in Memphis. We're all over the place. So we are happy to talk with you and get something started for prevention of your area, if you're interested, or if you know anybody who is. And that's it. Thank you.
Laura, I'll stop sharing. Are you able to share from your end?
I don't know.
Okay.
Find out in just a second. So hi, I'm Laura. And my job is to like come alongside these guys and provide a tool that can be used out in the community. If I can find my stuff.
As you're getting set up, Laura, I have to say, this is such an amazing resource. As you know, every time I talk to you, I think about, wow, these community tools that are kiosks that you're placing strategically across communities in Arkansas is just amazing. And so I'm grateful that you're here today to show us and talk about it.
Thanks. Okay, so this is what our kiosks look like. And as she said, they're out in the community. We have them in grocery stores. So they're like in Harps. We have one at XNA, which gets a lot of traffic from a lot of people that aren't even in Arkansas, but it's really cool because they're getting to see Arkansas resources. So on our kiosk, you see the TV at the top, and it just shows slides that say, did you know this resource is available to you? Did you know about this registry that you qualify for? Like all these fun different things, not always fun, but all these different things. And one of our main slides is just a different question than the ladies were asking earlier, which is, asking about suicide. But our question is asking, have you or a family member ever served? And so basically, we're just trying to get their attention to come check out the kiosk and see what's there for them. So that iPad at the bottom, this is what's on it. It's campconnect.com. So if anyone wants to go play with it, you can open up a little browser window or pull out your smartphone and just have fun with it. So under our health and wellness tab, all these resources that Kate was talking about today are right here. And so it's just an easy button. It connects right to the right page. They don't have to go Google it. You guys don't have to go try and find it. It's just real simple. she mentioned some today. I was taking notes as she was talking, and I'll make sure I get the rest of those loaded as soon as possible. But if you guys find any resources that work for you or in your communities that you would like to see loaded to Camp Connect, please just let me know. If you're interested in having a kiosk in your community or even our print material, we have a partnership with the DMV. So we're going to be rolling out kiosk and hopefully the majority of the DMVs across the state. And the ones that aren't large enough to have a kiosk will have they'll hand out our business cards that have the QR code on them that any veteran license plate or any military connected license plate will go to, like they'll hand that out with the license plates. Most recently, we added our leisure and discounts. So this is kind of fun because this gets people like wanting to go check it out. And then while they're there, they're seeing the other things that are available. So we like this week, we added our vacation tab. So all of these cool vacation spots are available to veterans, service members, and their families. So yeah. And that's kind of it. Like, again, this is just a tool that you guys get to use, and we want to see them in your communities. And we did add this new thing of surveys. And so we're doing an Empower Veteran survey. And it's really just seeing what resources are needed in your communities. And so if you wanted to go take this, or if you have a veteran or service member or a family member, that just really help us make sure we're pushing the right resources to the right places across the state. And that's kind of all that I got. Do you have any questions?
I just have to again say, I think one of the reasons this is for me such an important resource as I see it is oftentimes in primary care, we're trying to help people who have social determinants of health needs, and they're oftentimes saying, we don't know where to access resources. We don't know where to find resources. And so I love the idea that especially in our communities, rural communities, if we had these in a grocery store, if we have them in the DMV, these are places that all of us are going at some point, and it's a really easy place to access. And I love that you have the resources that are relevant to the specific communities as well as across Arkansas. So it's for me, a very user-friendly and amazing tool.
Thank you. And I see we have a question about veterans helping veterans, like a peer-to-peer approach is the question. We're adding that. We're constantly adding and developing and coming up with new things to add to Camp Connect. Soon we will have a sign up, sign in where you can build a profile, and the resources that you use frequently, you'll be able to like flag them or save them so you don't have to go find them again. And then we would like to add a peer-to-peer. So if they're, I'm new to this community, I want to go have a cup of coffee with someone I served with or someone who understands me, they'll be able to make that connection on Camp Connect and reach out if they need, they don't want to go talk to a professional yet, they just want to talk to a friend. Then that's kind of our goal, is to not lose that human touch that we were all missing during COVID.
Absolutely.
I'll add to
And
and I'm sure, in Fayetteville that this happens as well, but our suicide prevention team does do some post-vention work. So that's not veterans helping veterans, but we can provide resources to guide that, and or some actually, work with the families.
If somebody, so if someone calls into the crisis line and they report that, they know a veteran that died by suicide and they were needing support, we get a post-vention consult for that, to reach out and provide resources through, I'm going to forget what the acronym stands for, but the TAPS program, which is a really great program for folks who are survivor of suicide loss of a veteran. And, we also kind of get some more, get information where we can, and kind of provide also, we have our own process in reaching out to family or loved ones when we learn of a veteran died by suicide. And I linked in the chat the MIREC VISN for the VISN 19 post-vention resources, which was referenced in the slides, and kind of they are also available to community as well, for folks to reach out, because I think that's one of the things as providers, folks on this call, this touches us too. And how are we taking care of ourselves? Because I don't know if anyone else has had this experience. I've gotten a Teams message, oh, by the way, blah, blah. How are we, and then we're kind of expected, this is not in my current job, we are not expected to just kind of move on, but this has happened in other places of work, where it's like, we're just kind of expected to keep going, keep seeing the next patient. How are we having those conversations with our staff? How are we taking care of ourselves? So that we can, we're kind of filling our own cup and also showing up best for folks that we're seeing. So postvention through MyRec is also available for the providers and community as well. So it's a really important piece, and that crisis line consult is pretty new within the last 6 months, but a really great addition. So somebody can call the crisis line for that as well.
That's awesome.
Yeah.
I was also going to add to Misty's question about veterans helping veterans. We actually do have a really incredible peer program at the VA, and specifically we have a peer support specialist within our VA suicide prevention program who we work with very closely, who's incredible and basically works nonstop. But he is a incredible resource to our veterans, for sure. Veteran to veteran approach is definitely needed, and we utilize that as much as we possibly can.
That's fantastic. All right. I'm looking at the clock. I know that we're nearing 9 o'clock. We're getting lots of comments. Thank you for sharing these resources. It's really helpful. And, I think that you all hit it on the head when we started the presentation today, and as you talked about it, which was oftentimes if we're not working within the VA system, it may be challenging for us to know how to reach out, who to reach out to. We may not realize the depth of resources that are available to veterans and really to our communities. And so I just want to thank you for your time today. It truly opened my eyes. The more I talk with you all, the more I learn. To learn about the coalition building, across Arkansas, to learn about this new crisis line that's just been started within 6 months, where you're identifying patients, veterans in need and following up with them. And then, following up potentially for 3 phone calls and then the letter, really trying to reach out to them. And then, of course, having these amazing kiosks that are happening in all of our rural areas. And I know, Laura, the last we talked, you said we have plans and this is going to keep growing and growing. And it sounds like it has.
Yes, it has. I think last time we talked, we were at Camp Alliance or campconnect.info, and .com was just a new idea we were having of trying to expand it. And now it's all up and running.
Wow. Amazing. Well, all right. It is 9 o'clock. Thank you all for your time today. And thank you all for doing this amazing presentation and informing us about these resources. We will get the webinar posted to our website as well as the slides that are shared with us. And we'll be in touch if we need additional information on these resources. Y'all have a wonderful day and thank you.